Are you often stumped when deciding whether to code gastrointestinal conditions with or without bleeding? Today's ICD-10 quick coding tip focuses on how to accurately assign codes for gastrointestinal bleeding and related conditions. My name is Claire and I'm an inpatient coding auditor and educator. In my quick tips and tricks videos, you'll discover valuable insights to help sharpen your medical coding skills and code with confidence. If that sounds like something that would be helpful to you, please consider hitting that subscribe button so that you can be notified whenever I release new content. Gastrointestinal bleeding is bleeding that comes from organs within your digestive tract, including the esophagus, stomach, small intestine, large intestine, rectum, and anus. GI bleeding can be a symptom of many digestive system disorders, including reflux, ulcers, and cancer. The bleeding can be mild and ongoing, or it can come on suddenly and be life-threatening. Physicians may use different terms to describe gastrointestinal bleeding, such as melena, hematochezia, and hematemesis. Melena refers to black, tarry blood in your stool, typically originating in the upper GI tract. Hematochezia refers to bright red blood in the stool, typically originating from the lower GI tract. And hematemesis refers to vomiting blood or blood in the vomit, and it is typically a sign of bleeding in the upper GI tract. Always code to the highest degree of specificity when coding for a GI bleed. Melena, hematochezia, hematemesis, and rectal bleeding all describe specific forms of GI bleeding, so if any of these terms are documented, the appropriate code for melena, hematemesis, and rectal bleeding should be assigned rather than gastrointestinal hemorrhage unspecified. For example, if the H&P documentation indicates melena and then the discharge diagnosis is simply GI bleeding, assign only the code for melena as this is the specific type of GI bleeding. In the ICD-10 alphabetic index, there are many gastrointestinal conditions that provide the coder with an option to select either with bleeding or with hemorrhage. Some examples include esophagitis with bleeding, diverticulosis with bleeding, duodenitis with bleeding, gastritis with bleeding, an ulcer of the esophagus with bleeding, and ulcers of many other sites with hemorrhage. There is guidance from the ICD-10 coding guidelines that helps us with selecting the proper diagnosis codes in these cases. ICD-10 presumes a causal relationship between two conditions that are linked by the terms with or in the alphabetic index. This means that when the classification connects a main term to the subterm using the word with or in, it is assumed that the conditions are related unless the physician states otherwise. For these conditions linked by the word with or in, you do not need the physician to explicitly state the relationship between the two conditions in their documentation for you to assign the corresponding codes. However, if the provider clearly states that the two conditions are unrelated, then the presumed causal relationship is broken, and you would not assign the code that links the two conditions, and instead you would code them separately. This means that when a patient is experiencing GI bleeding and has one of those conditions that provide the coder with an option to select with bleeding or with hemorrhage in the alphabetic index, it is appropriate to report the combination code for these conditions with bleeding unless the provider documents a different cause of the GI bleeding or explicitly states that the conditions are unrelated. It is also important to understand that codes used to describe unspecified gastrointestinal bleeding, melena, or hematemesis should not be coded in addition to combination codes for GI conditions with bleeding. If the physician has documented that a patient has one or more GI conditions that have a linkage to GI bleeding in the classification, along with a term such as melena, do not code that GI bleeding in addition to the other diagnosis. Instead, code the definitive diagnosis using the combination code for with bleeding. Let's take a look at some examples. Although the provider has documented GI bleed and angiodysplasia as the discharge diagnosis, The documentation does not specifically state that the GI bleed was due to or caused by the angiodysplasia, but checking in the alphabetic index under the main term angiodysplasia, we see that it is followed immediately by the subterm with bleeding. Because the alphabetic index links bleeding to angiodysplasia using the word with bleeding, the coder can go ahead and assign the combination code for angiodysplasia of the colon with hemorrhage. Notice that in this example, only the combination code for angiodysplasia with hemorrhage is assigned. No additional code should be assigned for the GI bleed because the combination code for with hemorrhage identifies the GI bleeding. In this next example, the provider documented melena and gastric ulcer as the discharge diagnosis. The documentation does not specifically state that the melena was caused by or due to the gastric ulcer, but checking in the alphabetic index under main term ulcer, subterm stomach, we see that it is followed immediately by the subterm with hemorrhage. Because the alphabetic index links bleeding to the gastric ulcer using the word with, the coder can go ahead and assign that combination code for chronic or unspecified gastric ulcer with hemorrhage. Notice again that in this example, only the combination code for gastric ulcer with hemorrhage is assigned. No additional code should be assigned for the melena because the combination code for with hemorrhage identifies the GI bleeding. In this example, the provider has documented melena due to gastric ulcer, and they have also documented angiodysplasia of the colon as a discharge diagnosis. In this case, the documentation does specifically say that the melena is due to the gastric ulcer, so we're going to assign the code for chronic or unspecified gastric ulcer with hemorrhage. Now to code our secondary diagnosis of angiodysplasia of the colon, checking the alphabetic index under main term angiodysplasia, we see that it is followed immediately by the subterm with bleeding. But in this case, the physician has identified the cause of the GI bleeding as the gastric ulcer, and this means that the presumed causal relationship between angiodysplasia has been broken, and we should code the angiodysplasia as without hemorrhage. Notice again that only the combination code for the gastric ulcer with hemorrhage is assigned. No additional code should be assigned for the melena because the combination code for with hemorrhage identifies the presence of the GI bleeding. Procedures like an EGD or a colonoscopy are commonly used to investigate the source of GI bleeding. However, it is not always possible for the physician to identify the exact cause of the bleeding. Oftentimes, multiple potential sources of bleeding are found during these procedures, yet none are definitively identified as the primary culprit of the bleeding. When coding for conditions identified during the diagnostic process, if any of the conditions identified during the workup include with bleeding or with hemorrhage as a subterm in the alphabetic index, all of those conditions should be coded as with bleeding. These combination codes for GI conditions with bleeding should be assigned even if active bleeding is not observed during the hospitalization or during the procedure. GI bleeding can often be intermittent, and active bleeding does not have to be demonstrated during the hospital stay or observed during a procedure for the physician to clinically diagnose bleeding. As long as the physician has diagnosed GI bleeding, it is appropriate to report these conditions using the combination code for with bleeding. Let's take a look at an example. The discharge diagnosis is hematochezia, and the colonoscopy revealed angiodysplasia of the colon and sigmoid diverticulosis. No active bleeding was observed. Hematochezia is a form of GI bleeding, so because the provider clinically diagnosed GI bleeding and ICD-10 makes a linkage between gastrointestinal hemorrhage and both diverticulosis and angiodysplasia, each of these conditions should be coded as with bleeding. The fact that active bleeding was not seen during the colonoscopy does not preclude assignment of assigning the code for with hemorrhage. So that's it for today's quick tip. I really hope that this video was helpful for you. If it was, please give it a thumbs up, and if there's any topics that you would like me to cover in the future, just leave a comment below and I'll add them to my list. Thanks for watching, and until next time, happy coding!